I think the next phase will be a lot of things that, like scheduling, and a lot of elsewhere in industries have been able to do this. Can somebody talk to a chatbot and get the appointment they need with a carbon unit, as we like to describe it, backing the AI up? You won't not need schedulers, but you won't need as many. I think that that's the next piece here. All of this work, optimization of the schedule for the ORs, for the procedural areas. It won't be the clinical stuff next, even though the clinicians want it. And then eventually, so what the clinicians will do in the meantime is they'll go to open source, open evidence, and put information in and get information back out for them, but it won't be in context. It won't see the patient's chart. And then eventually we'll get to clinical decision support, which I think will be transformative. And that will require, instead of having large language models, that we have large medical models. These are AI tools built on medical information in patients' charts, not built on the internet. So as much as I love ChatGPT, I find mistakes all the time because it's built based on what's out in the internet. And a lot of what's out in the internet is wrong versus being built off of what's in a patient's record. And there's some errors there, but the error rate is much lower, better curated data, better AI model. And so once we get to the large medical models, not large language models, we'll be able to move to true clinical decision support, and it will be game changing. It'll allow physicians to make better decisions faster about the care of patients, and we'll miss less and hopefully be more efficient in our practice. And that's 2 years away.